I called myself low-code, no-code technologist. I am proud of it. Honestly, I'm really proud of it.
This episode, we are exploring digital transformation in healthcare sector and how hospital operations is getting optimized using low-code. Joining us today as a guest is UK Ananthpadmanaban, who is the Director and CEO of TenX Technologies and a low-code evangelist.
These IoT devices send data to the cloud of the vendor. I am able to visually, real-time data I am able to show to the doctors, show to the nurses, show to the lab in charges, and they have practically removed all the 40, 50 sheets of paper and now they are also feeling comfortable.
Let's tune in to listen to Anand's perspective. Hello Anand, welcome to our podcast. How are you feeling?
Doing well. How are you doing?
All good, all good. Happy to be here having this conversation with you.
I am also very happy to be here with you.
Yes. So I have gone through your LinkedIn profile. I can see that you have an illustrious career. You have 25 years experience in healthcare industry. So I want to know, how was that journey like? Could you tell us a bit about that?
As you would have seen in the LinkedIn profile, I did my engineering way back in 1978, and I was working for engineering industries for about 5 years. Then it was in 1983 I joined Apollo Hospital as a manager operations. And then I worked there for about almost 8 years. I worked there as a hospital administrator. What was interesting at that time, everything was manual, and I used to go on rounds and then inspect personally. And I had to communicate one-to-one with everybody. But somewhere in 1990, the computers started coming in. And we had individual computers. Maybe they were glorified calculators, They were not networked. And so still only billing was happening. Maybe sometimes registration was happening in the hospitals. But by 1990, when I moved to Coimbatore and when I started working in Kovai Medical Center, that was also a 400-bedded hospital. And at that time, the networking of computers had happened. That was a great boon. So mostly the networking was good in the sense that software had not developed, but networking was happening. But still, we were using Fox Pro and basic languages. But still, it was a great tool indeed. So when the Windows came in, I think that was another great revolution. So with the Windows coming in and hospital information system coming in, we had a lot of modules like a laboratory module, maybe stores module, purchase module, operation theaters module, registration, billing and all that. I think that completely changed the way the hospital started working. And that is when the automation came in. And I still remember one day when I was going on rounds, there was a problem in the ward. The problem in the ward was that they heard the glucose level as 19 instead of listening it as 90. They understood it through the phone that it was 19. It should have been 90. So, something happened and they gave some injections and the operation had to be postponed. Then only I realized that computers are so important, networking so important. From that day onwards, I stopped, telling the results through the phone. And then it was all through the computer system. So we had integrated our lab equipments into the HIS, and the HIS system was able to show the nurse what was the blood glucose value. And after that, things changed. And there are so many instances like that, I can tell you, which really made our job easy because of this computer system and software. But I think somewhere in 2000, when the Y2K problem came in, again, there was a lot of impetus on this hospital information system. And till about 2005, 2006, it was okay. I think the rate of growth was not so much. But after 2008, 2010, I think it gathered momentum. And we saw a lot of these new technologies coming in. Wi-Fi came in. Then we had technologies like BLE, cloud computing, all that came in. And so we started moving our on-prem servers to the cloud. So, and that too, at that time, we were also expanding in all hospitals like Apollo Hospital, Manipal Hospital, maybe even Aster Medical, Kaveri Medical Center, Kovai Medical, everybody started expanding. When they started expanding, they started putting their applications and data on the cloud. And it was at that time, the concept of cloud computing was happening. The SaaS models were emerging. And it was a very, very nice thing to happen. Because I was an engineer and I worked in the hospital operations for such a long time, I really started enjoying what I was doing. And I got many of my juniors involved, many of my students involved. Although I worked in the hospitals, maybe I come from a family of teachers, so I was also interested in exchanging ideas, knowledge to the colleges and schools. So I used to regularly visit engineering colleges, hospital management colleges, and then I was a faculty member in all those institutes. And I used to get interns from them, and I used to train them in many of these hospital information systems. But I think if you want to call it the tipping point, the tipping point happened about 4 or 5 years ago, when these low-code, no-code technologies were emerging. Wireless technologies like BLEs were all really catching up, AR, VR, then the real-time location tracking systems, RPS and all started coming in. But added to that, I think this COVID-19 was another great accelerator, I should call it. No doubt we had terrible problems in managing hospitals, and people really suffered. But we had a lot of learnings from that experience of COVID-19 situation. So people who did not accept, EMRs, electronic medical records, or hospital operations started really adopting. Government also became proactive, and so they had some telemedicine rules and all where guidelines were given. And so they started using telemedicine. It was at that time this low-code, no-code became really handy. And it was really a coincidence that I used to listen to a lot of your podcasts. And I am a great fan of your podcast, honestly. Particularly Zoho has a lot of these podcasts, educational podcasts. And I got hooked to this podcast, and I would have listened to about 100 of your podcasts repeatedly. It is something like people going to movies, seeing the first movie again, seeing the movie again and again. Like that, I listened to your podcast, and I learned a lot of it. So every time every time I saw that podcast, I learned something more. And that's how I implemented a lot of these low-code, no-code technologies in the hospital. And maybe as I discuss with you, I'll be able to tell you more about it, I guess.
Okay. So, but I want to take a step back. Let's say, for example, people out there, they might not know what exactly a director or someone's job in a healthcare sector would be, right? So in your day-to-day work in the hospital, was technology a main part of it, or what was the focus? How did a day in your life look like back in those days?
I think that's a very interesting question, in the sense, I was basically an operations man. I joined as an operations manager, then I became general manager of operations. Then I became the vice president of the hospital. Then I became senior vice president, then became president. Practically, I was handling the operations of the hospital. And most of those operations at that time were not digitized. You must understand that 15 years ago or even 10 years ago, it was not so digitized. But when the government gave a lot of push to the digitalization at the center level, at the state level, and the hospitals also started doing it. So I used to go on rounds to see what's happening. But once the hospitals expanded, when the hospital was about 10 lakh square feet, I was able to see only 5 lakh square feet a day. But when it became 10 lakhs and it became multi-location, then it became difficult. So we had just developed some softwares, implemented a lot of these applications, had dashboards, and these dashboards used to come to us to our desks, and we were able to monitor many of the units. All KPIs we used to monitor, but the KPIs come out of dashboards, the dashboards come out of reports, reports come out of applications. So what really happened was, when I was handling all these hospital information system vendors, in my career, I would have implemented at least about 7 or 8 hospital information systems from various vendors. And each of those applications will take about almost 6 months to 1 year to implement. If you take a 300-bed hospital or a 400-bed hospital, minimum it will take. The whole cycle is like that. They will come and do a system. We have to give an RFP. Then based on the RFP, they will give you a code. Then they will come and do a system study. Then they have to do some customization. They have to do some configuration. They will come and do user acceptance training. Then we clear them. Then they start implementing. And the entire cycle, we have a lot of these workshops for deciding the customization. The entire cycle will take about almost 6 months to 1 year. So with all that, not all users were very happy. And we did not completely cover everything, and it was not truly a digital transformation. It was only maybe a major portion of the hospital was no doubt done. But we still found many of the applications in the hospital, like managing ambulances, managing temperatures and humidities in the operation theater, which was very, very important during the COVID time, or managing some nursing hostels, or managing some medical equipments in terms of their location. You want to find out where they are located. For example, in our hospitals, we used to have about 500 to 600 infusion pumps and syringe pumps. We will have about 100 ventilators. We will have about 200 monitors. They are all spread in different ICUs, different blocks, different floors and all that. When they move, we don't know where they are located. But we had this very nice technology as Bluetooth low energy technology, where we used to put some tags on the equipment, and we used to track those equipments where they are going, and that data will come into our low-code, no-code platform. And that is where Zoho Creator became a very interesting application, and it was very easy to implement. I really remember when a vendor came, when RTLS vendor came, he said, "I will give you the technology, but I will not be able to give you the platform. You have to do your own data crunching and things like that." And for that, this Zoho Creator was very, very good. And it was the best fit that could happen. So like that, we were able to build in applications. And in one of the meetings, honestly, in one of the Zoho Alex meeting, where I was there, one of the panelists was saying that, no doubt low code, no code is very good. And definitely it helps us to, as a filler application and all that. I did not like it. So I got up and said, "Sir, I have been using it in the hospitals. I've built about 20 or 30 applications. They are not filler applications, but they are killer applications." So I told them it is really a killer application. If I had given it to a typical traditional hardcore IT professional, he would have taken about 2 to 3 months. But I did it in a matter of about 10 days. So, even the COVID applications are all done through low code, no code. So I've seen it in your YouTube that it was done by one of our partners. And so I think I found these low-code applications, it can be any vendor for that matter, that can really reduce the time you build the application. And it is easy to learn. It is easy to learn, easy to build. That they are all two different things. So easy to learn, easy to build, easy to implement, and very affordable. At the end of the day, you may say my application is great, it can be useful and all that, but it should be affordable. I must tell you, I don't know whether I should tell you here, I have seen other applications as well. I have seen applications like Mendes. I have seen applications like OutSystems, maybe even KissFlow and all that. They are all very good. They have their own merits. They have some good points in them, but sometimes they can be a little expensive. But one thing I found was that Zoho Creator, as a Make in India product, very affordable, and I found the support people, whether it is customer success team or a partners team, or even just a general support team for the customer, I found them very proactive and very good. And I think that is where the strength lies. And today, I, as a vendor, as an administrator, I'm known as a low-code man. I'm proud of it anyway.
Got it. So you mentioned about applications that you used to build before, which used to take 6-7 months time. At that time, how was who used to build this application? Did you have a team, or were the teams inside the hospital who were doing it? And what were you looking out for a low-code solution? Were you trying to optimize the whole building process? How was that interaction with low-code like initially? You mentioned you were searching videos, but something would have led to it, right? What was that?
Yeah, that's an interesting question. See, during the course of last 4 or 5 years in this so-called low-code journey, I understood one thing. Maybe people like us should not venture to develop a complete HIS solution. I told you HIS solution has got about 17 modules, starting from registration to billing to operation theater to laboratory and all that. But what we should do is to develop some applications which are not covered in this core applications. And there are now in the last 5 years, I see hospital information system has again got divided into two. One is the core patient care applications, and another is the ERP applications. When I say ERP, it can be SAP, it can be Microsoft Dynamics, or it can be Oracle, where you talk about supply chain management, HR, and finance. Maybe we should not dabble much, but I understand. In Zoholics, I was told now the low-code platforms have matured to that extent that even ERP solutions can be developed out of it. But maybe because our learnings are less than what they are, so maybe I am not still confident of developing ERP solution. But definitely I found between ERP and hospital information system, there are a host of applications. You call it temperature monitoring, infusion equipment monitoring, or maybe ambulance monitoring, or even a checklist for biomedical equipments or hospital management. I can tell you there are about 20-30 applications which are still done manually and which we have automated. And if you ask me what is the great advantage of this, believe me, truly, as I also develop as a consultant, I develop as a digital transformation consultant for large hospitals, medical college hospitals. I found I'm able to truly bring in digital transformation. So in the hospitals with three components. One is the core HIS component, another is the so-called ERP component, and third is the low-code application. Believe me, if I go to any hospital, if I see anybody working on an Excel sheet, if I see any email in their inbox, or if I see any phone call, that is an opportunity for me to low-code. That means I got a business out of it. So I'm able to convince them, and people are also proactive about it.
Mm-hmm. Got it. So that was a natural progression to finally founding your company, right? So TenX Health.
Yes.
So when did that happen? And I also read that TenX Health is a hyper automation company.
Correct.
So what do you mean by that, and how has low code helped in that hyper automation journey for you?
See, it is like this. Whenever we look at a system, I believe as a systems person, I need to understand that system, study that system, simplify that system, automate that system, and hyper automate that system. You understand that the hierarchies of the activities we need to do. So in those days, what they were doing is, they were doing things in the trial and error method, and they were doing. Then they talked about the system design, they systematized the whole thing. But they systematized this whole thing, and I think they jumped into automation. But no doubt automation can automate even complex things. It is not wise to automate complex things. It is wise to systematize and simplify and then automate. So to that extent, everybody was doing. When you talk about simple automation, okay, if you have an inventory control module, and if your inventory goes down below the critical level, you get an SMS or you get an email, and that is automation. But I think we went one step above. So there it was only an HIS giving a critical alert. But here we found that was not enough. So we had different technologies that were coming up. You saw AR, VR coming in. We saw robotics coming in. We saw pneumatic tube systems coming in. We saw artificial intelligence. Then you had ML, machine learning. Then you had maybe this same low code, no code, and all. These were all, at least about 15 technologies were really coming up in the last, say, 5 or 6 years. But I found for my healthcare applications, I found applications like this. First on top is my low code, no code application. Then my cloud. Without cloud, I cannot operate. Then I cannot operate without wireless technologies like Wi-Fi, BLE, NB-IoT. I cannot operate without them. Then, of course, artificial intelligence and visual big data analysis. These were the applications which I was using. But all these technologies were brought together on this platform. So I would say hyper-automation is the convergence of all the emerging technologies. But if you ask what TenX Health is doing, TenX Health is doing selective selective hyper automation technologies. We are not looking at all the 20 technologies. It is not required. And some of the technologies themselves have not matured. For example, AR, VR has not matured in healthcare. But whereas cloud is matured in healthcare, low code, no code has biometrics has matured. So I take all those emerging technologies and bring it into one platform. And then I provide a variety of solutions. And any problem, honestly, I will be able to bring it on low code, no code. I guarantee you that. Okay.
Got it. That's good to know. What do you like in a low code platform like, Zoho Creator? What are those aspects that you like about working on a low code platform?
Yeah, one thing I like very much is the speed at which I can automate. Okay. So they call it going to market or thing, but I don't want to use that kind of terminology. But what I really like is if I have a problem, if I have a workflow which needs to be automated, if I have been doing it before, as an operations man, I used to go to that IT guy and tell him, I have these 10 steps. Can you automate it for me? The first reaction is he'll say, sir, I am already overloaded with a lot of the other applications. So can you give me some time? For all you know, I'll be the CEO of the hospital, but still he will tell me that. I can understand, I appreciate his problems. He has got more pressing things to attend. But still, for me, that 10 activities in that workflow was very important. But now what happened was with this advent of this low code, no code, maybe I was able to think myself what kind of IT solution I can build. Then I had some really smart, intelligent people working with me. So to be honest with you, I identified some of those smart, hardworking people and I picked them up. I gave them tutorials of this. Believe me, I used to send links of these tutorials. I'll ask them to study. Then I'll sit with them, and within about 2-3 weeks, I myself will develop that application. And then I go to that IT guy and tell him, this is the one which I have developed. But what I suggest is have a look at it, and we will use it for some time. And if you are able to build it in your own Java or Python, nothing like that, we will use this as a POC. Believe me, over a period of time, that guy realized that it was better to do it on a low-code platform than again transform it into a hard-coded system. So I found it was very easy to build application. It was very easy to learn, and it was very easy to implement. So we did this software application, low-code, no-code application, but I had to convince my nurses. I had to convince my doctors. I had to convince my technicians. Believe me, they found these low-code, no-code applications much easier than the so-called hospital information solution applications. So they also learned it easy, and believe me, some of those nurses, doctors, and technicians like me more than they liked me before. Because I think not because of anything. It's not that I gave them an increment or I gave them a promotion, but I definitely made their lives easier, work life easier. So, and if they have any problem, they'll say, let us check with Ananth, So, sir, can you do this? They will ask. Typically, I must tell you, just about a week ago, my associate director of St. John's Hospital, Father John, he himself is a PhD in hospital administration, and he is the associate director of the hospital. He called me and told me, Mr. Ananthpadmanaban, I have a problem. The problem is I have 1,000 inpatients in the hospital, and I have to issue 2,000 passes to all those inpatients. One attender pass, another is a foot pass. They give 2 passes at the time of admission. And these 2,000 passes, they did not automate it. Anyway, the HIS was there, but HIS was not issuing these tokens. This was not issuing the pass. They were manually writing this. And he said, we also have a problem that the present patients used somebody else's passes, or this fellow had stayed in the hospital 3 months ago and he is using those old passes also. Because it is very difficult for the security guards to check whether it is an old pass, new pass, when there are 1,000 people standing in the queue. Then you won't believe I developed a beautiful application. I didn't develop, honestly. My intern from the Indian Institute of Health Management and Research, Bangalore, she was a dentist, and there was one more biotechnology guy, and both of them joined together. I only gave them, believe me, I only gave them the tutorials. I told them the framework. Within one week, it is there in the application. I can show you. They have developed a very, very nice, simple, intuitive application where the front office person can issue 200 passes, because every day 200 admissions happen in the hospital. If there are 1,000 patients, 200 admissions. The average length of stay is 5 days. So every day 200 admissions have to happen if there should be an admission, total admission occupancy of 1,000. So these people have developed this application, and we have also brought in expiry date of that token system, the pass system. So after 15 days, it will automatically expire. So they have to come and re-register. It's also a 1-minute job. So we are also able to eliminate the duplicate passes that are being issued. So these people will say, we lost the pass and give us one more. They will use it as multiple passes. But now I can say, no, you have already got a pass. You can, we won't give you another pass. All that was possible through this. This is a very small application, but a very impactful application. So, now the chief security officer is very friendly to me. That front office girl is very friendly to me. And the director is very happy. And I think we can do a lot of things using this very good thing. There are a lot of good things which we can do using this low-code, no-code technology.
Got it. Because all of them are happy because it has impacted, it has made their life easier, like you said.
Not easier. Lot more easier.
You touched upon one example, but I'm also curious to know more. You have worked in the healthcare industry, so you've seen the pain points. What are the issues which are there, or what is taking up the time for nurses and doctors, all of that. So can you give us some examples of actual use cases, the problem statements that you've seen, and then how you've built a application on low code, and then what is the end result? How has that changed? Some examples of that I think would be great.
In fact, we have built about 20 such applications and deployed them in many hospitals. We have deployed them in large hospitals, medical college hospitals, corporate hospitals, small hospitals with about 50 beds, 100 beds and all that. So the size of the hospitals vary, the nature of the hospitals vary, but the applications remain the same. Only the scale will change. Maybe there are 4 applications which I thought I should tell you in this conversation. One is the ambulance management and the vehicle management. This ambulance management and vehicle management does not fit in ERP, does not fit in HIS. Because HIS deals with anything that deals with the patient. Maybe ERP deals anything with finance and material. But this is one siloed application which was standing alone. They were doing manually and all that. This hospital, the St. John's Hospital in Bangalore, is a 1,500 bedded hospital. They get about 3,000 outpatients a day, and they do about 40 to 50 procedures a day, and they have 40 vehicles. Believe me, they have got 40 vehicles. Out of the 40 vehicles, 12 were ambulances and rest of them are other vehicles. So what we did was we put GPS sensors, IoT devices in all the ambulances and all the vehicles, and we were able to track the movements of those vehicles. And then the the data from those GPS devices were brought into our low-code, no-code platform. So we know when the ambulance started, when the ambulance reached the accident spot, how long it stayed in the accident spot, when did they come back to the hospital, what is the turnaround time of the hospital. That is very, very important in terms of NABH, and also from the patient's life point of view. I keep telling the ambulance technician that you are as important as neurosurgeon, if not more. Because if you bring the patient 5 minutes before, neurosurgeon will be able to do a surgery and save his faculties. Okay, so I think we must tell them that they are also very important, and for them to do like this technology is very important. So maybe for all you know that driver will be going in a longer direction, and so from here I can direct him, say that you take a shorter route and all that. He does it, and then when they come back, then we have to charge the patient. There are occasions where we send the patient from here to Uttarakhand. It may be about 700 kilometers, 800 kilometers away. Then the ambulance has to come back, and we charge per kilometer basis. So the cost can be even 1 lakh, the transportation charge, because for some reason, they want the patient to be brought to their place. So we charge 1 lakh. At that time, we really don't know whether we are charging the right price. So now the driver gives, the starting time, ending time, and there is a lot of, at least a little bit of uneasiness on the part of the accounting people, our accounts department, or also the patient. But here the GPS data and this driver data matches. So we have tried to match it with the low-code, no-code platform. We compute the charges through the low-code, no-code platform, but get the rates from the HIS. So we have integrated this hospital application into our HIS. We have integrated into our GPS. Just imagine there is a multiple integrations that happen. And today, all these ambulance drivers and my administration staff are great friends of mine because they feel that I have made their job very easy. Another application is that we have 40 locations. We have operation theaters, ICUs, pharmacies, and all that. And we also have equipments like blood bank refrigerators. We have ward refrigerators where we keep some medicines, vaccines, and all that. Here, the nurses note down manually what is the temperature every 8 hours, and then note down, and the supervisor comes and again certifies it. That is a requirement of our NABH, and it's also for the patient safety. But now what I have done is I have put IoT devices in those locations. I put IoT devices in the equipments, and these IoT devices send data to the cloud of the vendor. From the vendor, we get it to our Zoho cloud, and from the Zoho Creator Cloud, I bring it into the system, and I am able to visually real-time data I am able to show to the doctors, show to the nurses, show to the lab in charges, and they have practically removed all the 40, 50 sheets of paper, and now they are also feeling comfortable because if there is a power cut in the middle of the night, the refrigerator will stop working and temperatures will go haywire. But these things have really helped. Then we have some biomedical equipments. We have about almost 5,000 biomedical equipments. Can you believe in one of the large hospitals, we have 5,000 biomedical equipments. There may be about 200 varieties, but by number, there will be 5,000. You have to do preventive maintenance on them. We have to keep a record of the preventive maintenance. There is a checklist for preventive maintenance. What I have done is using Zoho Created, I have created a checklist for all that. So I have given a tab, and what all the biomedical engineers have to do is go near the equipment, do the biomedical inspection. Then they will just mark it onto the Zoho Creator application. And believe me, every day the head of the department knows how many biomedical equipments have been preventive maintenance has been done. And each biomedical engineer, how many equipments he has done preventive maintenance. All that data is available, and we are able to keep a tab on how the maintenance is happening. And we are also able to use it for calibration of the biomedical equipment. There are some data which we have to capture for calibrating the equipment. For example, a BP apparatus or a monitor or maybe a ventilator, we need to calibrate. Many of them are calibrated by the outside vendors, but some are calibrated by the hospital biomedical engineers themselves. So that calibration data is also captured. So whether it is biomedical equipment or ambulance or temperature or humidity, even for fire safety equipment, believe me, in fire safety equipment, we have implemented this checklist system where we have about 500 fire extinguishers. We have got about 100 fire hydrants. Then we have got fire pumps and all that. They have to be inspected regularly, whether they are there first of all, and then if they're all their pressure gauges are all working, whether they are serviced and all have to be checked. That is also brought into this low-code, no-code platform. And now it is done electronically and it is real-time. And so if NABH authorities come in or fire safety people come and they ask you whether you have done the service regularly or inspection done regularly, we are able to show. So practically everything is on this platform.
Got it. So from what you've said, I understand it kind of avoided the data silos and brought things together. Also gave better insights to people who are managing the system, I would say, right?
I think it is here you have to make a distinction. I think people like us must understand very clearly. The way you are putting it, you are saying, we have only digitized it. I am talking about digitalization. Please understand, digitization is only making some data into an electronic form. See, it is not enough if you just say that, this equipment is here and I have done preventive maintenance. But we should be able to say that this equipment is not here and this equipment, why it is not here, whether it has gone to the vendor or whether it has gone to the biomedical department, and when is it likely to come. If it comes, an intimation has to go to the, the maintenance guy, and they should be able to fix it. So a lot of automation is also involved in it. So it is just not enough if you just digitize, but you must digitalize. That is my feeling. Yeah, digitalization is important, and definitely these technologies, particularly low code, no code, helps you to do digitalization.
Got it. So I see that you identify yourself as a low-code evangelist.
Yeah.
So what does that even mean? Like, how do you explain evangelism to someone, and what do you do in that area?
Believe me, nobody gave me a degree as evangelist. Nobody told me that you are a great evangelist. But in one meeting, I really heard one person saying, in the way he was trying to introduce myself, he said, Ananthpadmanaban has been organizing a lot of these meetings. In Coimbatore, we had a meeting in collaboration with the CIO Club of Coimbatore and the Coimbatore Management Association. And at that time, I delivered a lecture on this low-code, no-code application for 1 hour. And then the Zoho people also did it. But at the time of the vote of thanks, he said, I know you are evangelizing the whole low-code, no-code. I said, then I should crown myself as a low-code, no-code technologist. And I called myself. I am proud of it. Honestly, I'm really proud of it. And I feel it is my social duty to do that. Because I feel if we can if you can really use this low-code, no-code platform to automate your activities, it's a great service you're doing to the community and the industry. See, things like HIS, the softwares like Hospital Information System automated our process. But what low-code, no-code did was automated that IT itself. You please understand that. And maybe Chat GPT is taking that to the next level, okay? So I feel that if I can really promote this concept of low-code, no-code everywhere, whether it is in the colleges or schools or in associations, I want to talk wherever possible. I want to educate people wherever possible. And I am very fascinated by the scheme Zoho has about a scheme called Marubadi. Not because I have got 2 daughters, but I genuinely feel that the women in India have to be empowered, and half our population is women. And ironically, not even half of that are employed. Ironically, half of them are not employed. That means almost about 200 to 350 million women are not employed, although they are employable. So I feel that if we can teach the so-called women who are graduates, for some reason they have to be at home for taking care of the children, or maybe for some other domestic reasons. If we can teach this low code, no code, they can do freelance work. They can really contribute to the society, contribute to the industry, and also earn. And they will be empowered and by money and by knowledge. I think that is what I'm trying to do. And so if you say evangelizing, this is exactly what I'm doing. I'm going from college to college. I myself volunteer. Can I do this YCP program? Can you believe that? So the YCP program in VIT is a classical example. And thanks to you, you're doing a great job.
Thank you. So in that, earlier in a college session, I heard you say it's in your vision to create 1,000 citizen developers.
Yeah.
Why do you think that is important, and what are the steps that you're taking to do that?
Honestly, if I want to call myself an evangelist, if I want to say that, I have done something to the community, I think I should really create some citizen developers, okay? So when I say citizen developers, I am talking about people who can do some low-code, no-code work, and they can be in any industry. They can be in retail, they can be in hospital, they can be in manufacturing, they can be even in NGOs and all that. So I felt that by doing all this, I may be able to develop about, say, 100 in women who are not working. Maybe 200 students like, in VIT or GCT or maybe in PSG. I can develop some citizen developers. Or in my own institutions where I am working, hospitals where I am working, I can create a center of excellence. And in that center of excellence, I can pull about 10 or 15 people and develop them as citizen developers. Or I can even develop citizen developers for my interns, people who come as interns. They are not students in the college, but they are interns who come to work with me. You must believe me if I say that I have already developed about 100 interns as citizen developers during the last 4 years. Many colleges, and they have been benefited. I have been benefited as a partner. I must also tell you that. And the industry has also been benefited. So I feel that in the next 5 years, if I have been able to develop these citizen programmers, 1,000 citizen programmers, that means I have done really something good to the society. And 1,000 is not a big number. I can do it next 5 years. if I do it in about 20 colleges, I think you saw today we had about almost 150 students showing interest in low-code, no-code platform of yours. And I am sure if I do it in about 10 such colleges, I am done. So I'll achieve my target of 1,000. And I want it to be a chain. I want it to, people like me, people should take inspiration from people like me. And I'll be able to do only 1,000. Maybe you will be able to do 1,000. Somebody else will be able to do another 1,000. And it should grow into a community of lakh or 2 lakhs of citizen promoters. It can be on any platform, but it must be a low-code, no-code platform, and I'm sure it will happen. I'm very sure it will happen.
Definitely. We hope to see you being successful in that very soon.
Thank you.
So one last question to you before we close, which is, let's say someone who's trying out low-code or getting, experiencing low-code for the first time. What will be your key input to them? How do they go about, and because you've gone through this whole process, you said you've seen a lot of videos and understood. So some advice to them on how they can get started and how this platform can be useful to them.
Yeah. Firstly, I think they must focus on some domain. I think the domain knowledge is very important. Maybe in my case, I was in hospital management. Somebody will be in engineering services. Somebody will be in trading. Somebody will be in construction or something. So I think they should not venture doing this in the first few years or something. So they must understand that domain. Maybe they should have worked for about 2 or 3 years. It's not that like me, they should work for 25 years and come into this. Why I didn't come? Because this low code was not there when I was there at that time, but now it is there. So I feel that people should work in a particular domain for about 2-3 years. They should understand the nuances of that system. They should understand the pain points of the system. They should understand the way things are being done, and they should find out if they can do that better. They can do it simpler. And once they have found a system to re-engineer, and if they have studied it, if they have simplified it, and if they have tried to automate it, I think this is the best way to do, and that's how they should do. And as Mr. Sridhar Vembu always says, you don't have to be an MTech to get into the system. I love that, really. But that does not mean that a 5-year-old school boy can do that. It's also like that, not like that. Maybe a +2 level kind of an education is required, but nothing like if he has done a BSc, a graduation, or an engineering degree, medicine degree, nothing like that. It is definitely an added advantage. So I feel they should, a little bit of education knowledge is required. And then maybe understanding of the domain is really required. And they should have a passion to improve the productivity and efficiency of anything. That's very important. That inner urge to improve the productivity and the efficiency is very, very important. And if we can do that, and you should also have some mentors who can help you. So you need to choose some kind of a mentor, maybe for about few years, and then you will become a mentor. So you can become a partner, and you can benefit, and the other people also will benefit. That's how I feel you should do it.
Got it. So thank you so much, Ananth sir. It was a pleasure having you, and a very insightful conversation. And I feel if even one person, takes away from this and is able to take that first step, I think it'll be a success for all of us. Thank you for joining us today.
Thank you, Mira. It was a great privilege and an honor. And thank you very much for this wonderful opportunity. And thanks for everything. Thank you.